Welcome to the AI Chat podcast. Today on the show, we have the pleasure of being joined by Dr. Harvey Castro, who's an esteemed physician, entrepreneur, and former CEO. He's known for his pioneering work in integrating AI into healthcare management and his role as a strategic advisor for people looking to implementing ChatGPT and other AI tools into healthcare. Super excited to have you on the show, Harvey.
Thanks for having me. I appreciate it.
So, like I mentioned, really excited to have you on. I have to say, like, when I cover AI, one of the areas that I'm the most excited about, I think, is kind of AI and how it integrates with healthcare. I'm not just saying that because you're on the show today. Anyone that listens knows I probably say that at least once a week whenever I cover some sort of healthcare topic. I'm, super excited whenever there's some sort of AI that's, helping with drug discovery or really anything. I just feel like healthcare is such an incredible area that impacts everyone in the world so deeply. So what I would love to kind of kick this off with is I'd love to hear from you. Give us a little bit of your background, your journey, what inspired you to kind of get started on this in healthcare in general, and then tell us a little bit about how AI plays into that and when you kind of started getting involved there.
Have you ever wanted to start your own podcast? I record and publish podcasts on a platform called Spotify for Podcasters, and I absolutely love it. Essentially, you can upload from your phone or computer, and it distributes to every platform that plays podcasts. They support video podcasts, and you can make money on the platform with ads or even podcast subscriptions, something that has made my life so much easier as a podcaster. So if you're interested, I highly recommend you give it a try. You can download the Spotify for Podcast app, or go to spotify.com/podcasters to get started on your podcast today.
Get everything you need for your holiday meal at Whole Foods Market. Right now, you'll find animal welfare certified rib roast on sale. It's a deliciously crowd-pleasing centerpiece. Plus, save on spiral sliced ham, bone-in lamb, and seasonal produce like sweet potatoes and Honeycrisp apples. For ready-to-eat sides, head to the prepared food section. Done. And remember that Whole Foods Market caters. Order gourmet catering at shop.wfm.com. Bring the holiday magic with Whole Foods Market.
Well, thank you. So I hate to go way back, but I'm going to go back to the first iPhone. I'm an ER board certified physician. I've been a doc for over 20 years, and I was coding a patient, and I was in the emergency room, and I told the nurse, hey, we need to start this IV drip. And she's like, 1 second, doc. She got a textbook out, started going through it, and verified the dose and said, okay, we're good. Let me get the medicine. And I'm looking at her like, whoa. Like, I know this person's dying. Like, we can't be taking minutes. We need to do this in seconds. And so, again, I'm holding the first iPhone, and I thought, I wonder if I taught myself how to program an app, and I can create something called IV Meds and just help people, it wasn't even looking for money. It was just like, hey, we need to save lives. And so I made really a simple app, and it went viral. It went in the top 10 in the world. And then fast forward, I'm playing with ChatGPT, and it happened to come out that day, so I lucked out. And I'm playing with it last year, and I thought, holy cow, this is going to change medicine. This is going to be so different. So the nutty professor that I am, I was like, I'm going to write a book and tell people that if they use ChatGPT in healthcare, they're going to be helping. And so I literally wrote the first book on ChatGPT in healthcare last year, got published January 1st of this 2023. And long story short, since then, I've just been obsessed with AI. And then every time I put my doctor hat on, and I'm like, oh my God, we can do this as a doctor. And then I put I'm just like really just all in, like any kind of update that anyone has, I'm like all in. So I love listening to your show because, there's different things and updates and different theories. And I just put the doctor hat on it. And so fast forward, it started just as a public service announcement, like, hey, let me help out docs, let me help out patients. And all the books behind me are all the different books that I've been using AI and leveraging AI plus medicine and kind of explaining how it could be used out in the world. And so I'm really, really stoked. I know that's a lot of information, but wanted to kind of give you a good background.
No, that's amazing. That's so cool. And first off, amazing you're in ChatGPT day one. That's incredible. You got that book published January 1st. Obviously, you got some amazing ideas probably already kicking around that all applied into everything you're seeing. Tell us about some of the response to that book that you've written. How has this been received in the healthcare industry? How do you think overall AI is kind of being received in healthcare? Is this a positive thing? Are people concerned about it?
Well, the first statement I can say is at the beginning, people were like, "Chat who? What are you talking about? Have no idea." And they looked at me like I was some just crazy person talking, and they literally had never heard of it. So I was the first person to introduce it to them. From a community point of view, obviously healthcare is very conservative. There's issues in healthcare that it's not like if you pick the wrong stock, you lose some money. No, if you do the wrong thing, someone will die. So the stakes are really high. Obviously, there's a lot of ethical issues and pushback and something new. To date myself, when I was in medical school, doctors, when my attending doctors would tell me like, I hate Google. There's all these people that come in with Google documents, and I'm like, well, fast forward now, it's not Google, it's ChatGPT, doctor, that's coming in. And so, for better or worse, I thought I need to educate because I don't see this as a bad thing. I think anything can be a bad thing if it's used incorrectly, but if you use it correctly, I really think, like your Tesla car could kill someone, but if you use it right, it actually prevent accidents. So anyway, big picture, it's been received with mixed feelings. I feel like some doctors have been as bold enough to tell me, it's like, you know what, if this is incorporated in my hospital, I'm retiring, I'm out. I'm like, wow, that's one extreme. The other extreme, I love talking to residents and different entrepreneurs in the sense that they're like, oh my gosh, I could use this to teach me medicine, or I could use, like one example that I give, I personally clone my voice and have my own podcast. And my point is this, you could, in theory, summarize some parts of medicine on your drive to the medical school. You can put it in your phone or whatever way you listen and learn medicine that way. And that's something quick that you can use Gen AI to help you, learn medicine. Some of the, I call it the bell curve. We have early adopters that want to like, hey, how do I do it? And then we have these that are just kind of standing back, watching on the sidelines to see what happens. This year, I know it's been crazy. We have had it from A to Z, and then every time we think we're catching up, and then OpenAI comes out with, more stuff that's out there or other companies. So I'm really stoked about that.
That's fascinating. Something I'd love to ask you about is like, in everything you've seen so far, what are the areas in AI and healthcare that you're the most excited about? Like, what are the areas that you're like, I know, like, it obviously impacts a lot of areas. There's disruption everywhere, but give us some of your top picks.
Yeah, that's a good question. So I'm a big educator. I think on two sides. On the patient side, we're going to see more education, and then on the doctor side, we're going to see education. In medicine, believe it or not, every 30 days, our medical knowledge doubles. So I would literally have to be reading medical journals 21 hours a day, every single day, just to keep up, which no one can do. Obviously, that's why we do different specialties, because there's no way you can know all of medicine. Even though you have that MD or DO, that doesn't mean you know everything. That just means you know that area. And so how I see ChatGPT, I really see it as, with all that data coming, why not use GPT to help us with summaries, help us with, instead of reading, a 30-page document on the latest study, then read a summary, and if that looks good, then you can go in. And I know there's already services like that, but the ability to be able to just take any document, upload it, and then have a conversation with it. I may not want to know all these specific parts of the article. I may just want to know certain things. So now I can just upload it and just have a conversation, and I can maximize that. Instead of reading it for 10 minutes, I may only need 2 minutes and really efficient and get what I need to get out of it. And so big picture, I'm just stoked about that. Now, on the patient side, man, I'm really more stoked because I feel like now patients can be empowered with GPT. And I know some of my colleagues hate when I say that, but the way I see it is the following. Just last week, GPTs have been announced. And for fun, I just created my own GPT that literally my goal is you take this with you to the doctor. And so when the doctor is talking mumbo jumbo about X disease or Y disease and the patient really doesn't understand, the average time with the doctor is only 13 minutes. But what if I empowered you with your own GPT that you could ask the doctor, hey, you said diabetes, this and that, I don't understand. And then GPT is able to listen, converse, have a conversation, educate you. And then the doctor can be there saying, you know what, it's hallucinating. You know what, this isn't correct. You know what, ChatGPT did a good job explaining this. There's been some studies, and I know you probably seen this, where they're saying empathy is better in GPTs than a doctor. And so that tells me there's a lag here. And why not leverage the latest technology like the one I just said in healthcare?
I love that. I'll say, like, even for myself. Like I've seen a number of studies or reports. There was one that came out recently about there's a woman who her child had like pretty severe health problems for a very long time, went to tons of specialists, was not able to get the solution, finally went to ChatGPT, plugged in like all the symptoms, like tons of stuff, and it was able to accurately find a diagnosis. They went to a specialist, it was confirmed, they found a solution, and she was like blown away. I'm not sure what it is, and I would love to get your thoughts on this. My wife is she's constantly self-diagnosing herself with everything, but maybe it's a common thing today for people to do. But the greatest thing for me is that instead of every time, I don't know why, every time she goes to WebMD, the answer is she has cancer. Every time she, done lots of tests, she does not have cancer. She's doing great. But for some reason, WebMD, whenever you put your symptoms in, there's a lot of extreme examples it'll give you. When she goes to ChatGPT and like says, hey, like I'm feeling like, my hand is tingly, and there's like, blah, 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 I don't know, whatever her symptom is, she puts it into ChatGPT, and all of a sudden it's like, oh, well, it's possibly this. It's probably not cause for alarm. You could look at this. It's like, and it's helped diagnose like things. So like, what is the difference in your mind? Why is a tool like ChatGPT doing so much better than, I mean, I hate to say, doctors or specialists like that woman had, but I mean, that is an extreme case. But even something like WebMD, right? This is kind of the precursor, and you could assume that a lot of the knowledge ChatGPT was trained on came from WebMD when they scraped the whole internet. How was it able to more accurately diagnose than articles or blogs or sometimes doctors?
No, that's a really good question. Going back to that case, that poor child had gone through 17 doctors before it got a diagnosis, and the diagnosis with tethered core syndrome. And how does that happen? I think it's tough to say. Obviously, I don't know the particulars of that case. I wasn't in the room. But what ends up happening is different doctors see things filtered in their specialty. So I'm an ER doctor. So to me, everything in life is an emergency. Everything, I'm biased towards, worst case scenario because that's what I see. Whereas if I have a good friend of mine, he's a pediatric cardiologist, and he claims there's all these pediatric cardiology disease that if they caught it, it's the cardiologist. And so my point is this: ChatGPT has all that data, and it has more data than MedCal or MedMD rather, or all those MedConsult, all those different websites, because it has the entire internet. But what they did smart is they did reinforced learning. Now, they didn't put doctors to do reinforced learning, but they had so much other data that they were able to compensate. And so why it does such a good job is I feel like to some degree it doesn't have the bias because now it's looking at it with all the lenses.
Get everything you need for your holiday meal at Whole Foods Market. Right now, you'll find animal welfare certified rib roast on sale. It's a deliciously crowd-pleasing centerpiece. Plus, save on spiral sliced ham, bone-in lamb, and seasonal produce like sweet potatoes and Honeycrisp apples. For ready-to-eat sides, head to the prepared food section. Done. And remember that Whole Foods Market caters. Order gourmet catering at shop.wfm.com. Bring the holiday magic with Whole Foods Market.
This episode is brought to you by Shopify. That's the sound of switching your business to Shopify, the global commerce platform that supercharges your selling. Harness the best converting checkout and same intuitive features, trusted apps, and powerful analytics used by the world's leading brands. Stop leaving sales on the table. Discover why millions trust Shopify to build, grow, and run their business. Sign up today for your $1 per month trial period at shopify.com/tech23.
As opposed to my filter lens that I see everything this way. Now, is one better than the other? No. In my book, I look at it like this. AI plus doctor is better than just doctor. And then doctor is better than just AI alone. Because the doctor, it's something called the art of medicine. There is a true art. Me seeing you, there's things that right now ChatGPT is not quite there. Where like if I see you and I see your voice changes or the inflection or something you do in your eyes or you look away, I'm able to pick up on those things where ChatGPT takes it for what it is. So if you start joking around with it during the interview, it's going to go down another path because it's, you may be saying certain things and I know you're joking, but ChatGPT will be like, no, that's literally what I heard. And so there's some nuances. The biggest scare for me personally, this is one of the reasons why I went out there writing the book, is I'm personally worried, especially people outside of the United States that can self-diagnose, walk up to a pharmacy and say, you know what, I have this disease. I'm going to take this medicine according to ChatGPT, and it's something wrong. They have that emotional trauma that they think they have cancer, or that they take this medicine and they don't need it and they end up, shooting their liver or something. That's my personal worry. But I think there's a balance. I really think it's doctor plus AI together will give you a better yield.
Yeah, I love that. I think that's so accurate. And I think you bring up a really interesting point that I'd love to dive into, which is even in the United States, there's a healthcare worker shortage. Like, it's something that, a lot of hospitals and whatnot struggle with. But in other countries, there's indisputably that shortage. And so what impact do you think a tool like ChatGPT AI is going to have on other countries? Do you think that people will, like you mentioned, is this going to become a common thing where people are going to just go to ChatGPT? And beyond just a shortage, right? Like, let's talk about countries with very low income. Like, going to the doctor might be too expensive for someone when they're like, look, I could just use, this AI tool. It's going to do a good job of diagnosing. What do you think the impact globally is going to be, especially outside of the United States?
And I love this question. This brings up ethics, biases. I'll start with the biases. Obviously, we studied the entire internet, but it's really using a lot of information, data from research here in the United States. And the token size, that you understand this well, it's not going to literally translate as well. So I'm going to pick a country in Africa. If they start translating, it's going to be less tokens because the words don't translate, the theme, and then there's some hallucinations. Now, the data is different. So if I say breast cancer, these are the treatments, that population in Africa is going to be different, and it shouldn't be treated the same, and it's going to have some biases. Now, what's going to happen in the future? I love looking at this iPhone because I think this is going to be your doctor one day. It'll be all here. It'll have enough of the basics. Like, I see a future where Apple has, this has put 34 million parameters on the newest iPhone. So I see in the future CPR will be on this. So if you're in the Grand Canyon, there's no Wi-Fi or internet, cellular service, it'll still tell you how to do CPR and help save that life. How is it going to happen? I talk about this a lot, and I think personally Africa is going to start seeing things before the United States because pros versus cons. We got areas of Africa that have zero healthcare. There's no doctors. And so I really do see a future where, Elon Musk satellites are out there, and Africa is going to send maybe some PAs and some big vans so people come in and they're able to interact, and that'll be their healthcare. That will never happen in the United States until that happens outside of the United States, and then there'll be some internal pressures to happen here. So yeah, I think the future is going to be interesting. I don't think I think we need our own models in our different countries, and so to make it more home here in the United States, the data that I collect here in Texas is nowhere near the same as the illnesses and populations that are in California. And so why use the same AI for the both? So I think the future will be what's called federated learning, and we're going to have our own data from our own hospitals, and it's going to be that's going to be the AI that's going to be very local but specific and more helpful for that population versus another.
Yeah, I love that because I think in the future, that's where it goes. We're going to have thousands of AI models that are specifically, whether it's geographically based or topic based. Like they'll have special data sets that they'll go very deep in on areas. So I think that's fascinating. One question I'd love to pick your brain on is, you mentioned the power of having AI plus doctor and essentially how those work together. Great. This is also something I've heard in a lot of different industries. So I went to an AI conference this summer in Las Vegas, AI4 conference, and it had the top executives from a lot of the Fortune 500 companies and the people in charge of implementing AI there. I heard the same line from a lot of them, which was AI is not going to replace your jobs, and using AI will. And they kind of cling to this, it's all going to be okay. Now, in my pessimistic view of this, and not even pessimistic because I'm not sure this is actually, I'm not going to say whether this is actually bad or not, but in reality, I think a lot of jobs will just be completely replaced by AI. I just think that's going to happen inevitably. In the case of doctors, you mentioned a doctor kind of has the ability to see you, to hear the inflections in your voice, to see that, your skin could go, for me, if I was super sick, I might go super white or super red. There's visual cues and stuff. But with ChatGPT rolling out GPT-4 vision and, being able to listen with audio and that aspect of it, do you think we ever get to a place where whether it's ChatGPT or something else, maybe specifically trained on medical data from your geographic location that's the most accurate. Do you think we ever get to a place where AI completely replaces a doctor's visit?
My personal take, I think, unfortunately, it's going to be economics. I think that we're going to have another tier, and I think people will start signing away their, somewhat rights and say, you know what, I'm okay with paying this, and I'm okay with using a robot. And for these type of medications or these type of medical issues, I'm okay using AI. But I will sign away a waiver that if it messes up, if I die. And I think because of the economics of healthcare, I think it'll push people to that level. Now, that's an extreme example or statement, but I want to show you, and you'll relate to this example. The average nurse is about 54 years old, with 20% of that being about 64, 20% of that being 64 and up. Now, that tells me we have an aging nurse issue. Now, obviously, we're short on doctors, all of healthcare. Now, listen, you know this well. Now, OpenAI has ChatGPT 4, and yes, you're right, the vision and all that stuff. And I just read a study this week that talks about nasal, in the sense that you can map out all the different smells, and now AI can recreate those different smells and the chemical reactions. So technically, that's just going to be another world right there. And then another thing to what you just said, my voice, this camera, literally you can rig up this whole conversation and say, okay, what's my average sugar? What's my age? What's my blood pressure? Just with this feed that we're throwing right now. So now imagine all those things that I said, and we throw it into a robot that that OpenAI has invested in robots, and that should be coming out here in the next few months. So imagine you took that robot, you put the eyes of ChatGPT 4 or 5 into it, and now I see that as my assistant. I see that helping our nurses. I see that bringing medications. I see that robot going into the room and saying, hey, are you okay if the robot's with me? And then it's looking at you and saying, oh yeah, his sugar's this is that. And then educating you. So maybe you speak another language and I don't speak your language, but I'm talking to the robot and say, hey, translate this to this language and explain this. And he's from South America, and let's use these examples. And it goes into the database and says, okay, these are the examples. Because if I start talking U.S. football, they'll be like, what? You mean soccer, right? And so things like that the robot's able to do. And so I really think that is going to be the future in healthcare. It's not going to be me being replaced per se. It's going to be more supplemented. And then to your point about losing jobs, I call it the great shift. Yes, there will be jobs lost. And it's not going to be a one-for-one, meaning, one person lost, but there's going to be a new job. Some industries might be a 10-to-1, some may be a 1-to-1, but some may be more of a supplement. In healthcare, for example, dermatology. Let's say I had this big spot that it was cancerous. Most family doctors don't want to mess with it, and they'll just send it off to the specialist. Now the specialist is overwhelmed, and if you really have an emergency, a really big issue in dermatology, the dermatologist has to go all through stuff that really shouldn't have gone there. Well, now with AI, it's going to make me better. Say I was a family practice doctor and I have this technology, and now I'm going to be sending you things that are the top issues. That way, now the shift has occurred. Now you're not seeing all these patients that you used to. You may call it, that's a revenue issue, but at the same time, I could argue that it's like, no, now you're really seeing what you need to see.
Mm-hmm. Yep, 100%. Yeah, no, I'd agree with you there. That's actually something I talk a lot about. Tesla is making Optimus a humanoid robot. You got Boston Dynamics. You got all sorts of these robots coming out, and pairing those with AI is going to be huge in so many industries. A lot of people that don't really think about the impact of AI. If you have humanoid robots, you essentially have electricians and plumbers and welders and that can do it at the exact same level as a human once you train them. And the training methods are there. Essentially, you just have a human wearing like a full body suit doing the task, and there's sensors all over. It transfers the data to the humanoid robot. It can now do the task with the same fluidity. So it's going to be really fascinating to see where this goes. Harvey, thank you so much for coming on the podcast today, listening to my wild questions and responding. As we wrap up the show today, I would love to ask you for one piece of advice you feel like you could give to maybe just general listeners thinking about healthcare and AI, and then maybe if we have any docs, specifically doctors or people in the healthcare industry, what's a piece of advice or something you feel like you could share with them?
Yeah, well, we didn't plan this. I'm going to bring up my prop. These are the new Meta glasses, And these are transition lens, so I can go outside and these glasses. But for people out there that don't know or not are just listening, basically these glasses I can take pictures, videos, but they're going to start adding in the spring of next year a way of using taking a picture of something and saying, hey, how much is that car? Or in medicine, hey, I hear my discharge instructions and I don't understand them. Help me look at them and translate them. And so my point is this. My tip to everyone is embrace AI. Look at your vertical, see how it works, and then instead of being scared of it, take it and see how that can make your job better, how you can improve patient care for those doctors that are outside. And then for you to improve patient care is twofold, is the way you speak to patients, your empathy, help it pick the words for you, your mannerism. But then on the education side, I challenge you to start using that to help you. Now, you've had that experience with medicine, so you know if it's hallucinating or not. But let's like riding a bike. Get on that bike and start using it.
Love it. Thank you so much, Harvey, for coming on. Incredible advice. Also, those are cool glasses. I'm not going to lie, that's the first time I've seen someone wearing them in real life. So that's super cool. To the listener, thank you so much for tuning in to the AI Chat podcast. I'm going to leave a link in the show notes to Harvey's book that you can find if you'd like to learn more about what he's talking about there. Thanks so much for tuning in. Make sure to rate us wherever you get your podcast. And I hope you have a fantastic rest of your day.